When a nurse suffered sudden cardiac arrest at work, her relatives were stunned to learn that no one gave her CPR for more than 7 minutes.
Her family is questioning how that's possible at a facility connected with a highly regarded cancer center. The woman, who was devoted to her family and her patients, is now quadriplegic. Her workers' comp claim denied by her employer.
We have a warning now. Some of what you're about to see is difficult to watch.
She loved being a nurse. She really wanted to help people.
Andrea Morris lived an active life, working as a nurse, running marathons, and raising her 3 children as a single mom. But all that changed May 14, 2020. Andrea arrived to work at the City of Hope Cancer Infusion Center in Upland. According to court records, she told her supervisor, also a nurse, that she didn't feel well and worried she might have COVID, a constant concern in those early months of the global pandemic. Pam Bertino is Andrea's sister.
She was really worried about her kids and getting it from a patient or another medical professional and then giving it to one of her children.
So a lot of anxiety and stress.
A lot of anxiety and stress, just all the time.
But the symptoms Andrea worried were COVID-related turned out to be the first signs of sudden cardiac arrest. What you're about to see is difficult to watch, but Andrea and her family want you to see it.
She is literally moaning.
Nursing supervisor Carolyn recorded Andrea's medical emergency on her cell phone as she called 911. Both recordings shared with the I-team by Andrea's attorney.
I can't get a blood pressure on her. She's completely moaning right now, like she looks like she's having a seizure.
Nurse Cerna mistakenly and repeatedly referred to what was happening as a seizure, but not getting a blood pressure reading, even manually.
I'm not seeing her move at all. She's not breathing? No.
In an ongoing workers' compensation trial, Nurse Cerna was asked by Andrea's attorney, once you couldn't get a reading on her blood pressure, it's a fact you didn't start CPR. Correct. This was a missed opportunity to save her, wasn't it? She responded, I don't agree with that statement. When asked, can you explain how videotaping helped her in that emergency situation? Did it help with her breathing? Did it help with her getting oxygen to her brain? Nurse Cerna said no.
It's really scary to think that your boss would take a videotape of you essentially going into cardiac arrest and having agonal breathing instead of reacting and giving CPR.
Attorney Keith Moore points to repeated failures to properly assess Andrea and to react.
There were 6 different chances she had to recognize, do something, but she did nothing.
And he says witness testimony shows it wasn't just her supervisor, Nurse Cerna, who was present.
There were 2 nurses, 1 medical assistant, and 2 doctors, all City of Hope employees.
One of those doctors later saying under oath he was not qualified to perform CPR.
There was a defibrillator very close by, oxygen very close by, and they just didn't react. And to me, it's the biggest mystery of the whole thing. She was dying. Her lips turned blue and then purple.
In court testimony, Andrea's friend and fellow nurse Alma Harris said it wasn't until she arrived on scene that Andrea finally received oxygen and chest compressions. But that was more than 7 minutes after that 911 call began.
Okay, we're going to do CPR. She's not breathing.
8 months in the hospital followed. Her family says they were forced to sell her home and liquidate her 401k to help pay for her medical expenses. She now lives with her parents, who are in their 80s. Her 2 sons also help with caregiving.
There's this woman that was an athlete, and she's lost her livelihood. She's lost her, herself as she knew it.
Andrea is now quadriplegic, requiring 24/7 care, which costs more than $200,000 a year. She's unable to take even a sip of water on her own. During a break in the trial, she talked about seeing Nurse Cerna's video for the first time of her sudden cardiac arrest and her boss's response.
You didn't like it? No.
I was sad.
Nurse Harris, who stepped in to save Andrea's life, testified in trial she felt she couldn't say the truth about what happened when questioned during a deposition, and that an attorney representing the City of Hope hit her chair to silence her. Nurse Harris told the judge she thought the attorney was going to hit her. Nurse Harris still works at City of Hope and felt nervous speaking on camera, but she wanted to share this message.
All healthcare providers should be prepared for basic life support.
Almost 4 years have passed since Andrea's catastrophic near-death experience, which her sister believes was brought on by the immense stress of being a frontline worker during COVID. And even before the pandemic, the published job description for her nursing position states employee will work under stressful conditions. Her family is appalled by the denial of her workers' comp claim.
What's your message to the CEO of City of Hope?
Take responsibility. This happened on your watch. You know, you have insurance. Please help this woman that helped your patients, that helped your business.
The I-Team reached out to the City of Hope, which said, as this is regarding pending litigation, we will not have a comment.
Now, late yesterday afternoon, City of Hope provided this additional statement to us. It reads, "We are deeply saddened by the serious medical event Ms. Morris suffered in 2020, and our hearts go out to her and her family. The health and wellness of our employees and all those we serve is City of Hope's top priority. We remain committed to maintaining a safe work environment for our staff and clinical teams." Now, the trial is ongoing, and because trial dates are not consecutive in workers' comp cases, it could be several months before testimony is complete. City of Hope's attorneys have not yet called their witnesses.